Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Oh, there's my Virginia crew. And we got Latvia every day. Bless you. It's going to be 85 today. On the porch with coffee. Oh, sounds lovely.
Purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit
Joey's back in North Carolina.
And enjoy the show.
Alrighty. So I got a text message from Sweta Desai, who is now employed by us and helping us out with social media. And she is very concerned because she took her dog in for senior lab work, and during the exam they found a new lump, and it's actually inside the upper lip. And so it made me think, how often do you do a physical, hands-on palpation and look at your pet, whether dog, cat, horse, bird, whatever? How often do you go nose to tail and really inspect everything that's going on? I mean, a lot of us, we find lumps and bumps because we're petting them or we're rubbing their belly and we go, there's a new lump or bump or whatever. But how often do you actually open the mouth, really look in there, look under the lips, lift up the tail, really inspect the back end around the anal area, get in the armpits, go down the neck, feel the lymph nodes, which are just like ours. You know, they're right in the neck, they're in the armpits, they're inside the back legs, they're halfway down the back legs on the hind end. How often do you really go through them? Like, just, give them a good massage all over and feel for small lumps and bumps. And not often enough, exactly. Really, we need to be doing this at least once a week, nose to tail. For instance, Georgie, our little Georgie, he loves to lay upside down in my lap. I mean, he just sprawls out. Well, that's a great time. He's there for a belly rub. But for me, it's inspection time. He has a lump on his rib cage. It's a soft lump. It's been there for years and years. But it gives me a chance to feel it, make sure it's not changing. I get up in his armpits, I feel for knots or things that he's got stuck in there, under the neck, feel the lymph nodes, check out his little knees in the back and make sure that, they're not popping out of place. Getting up under the lips, taking a look at what's in there. Yesterday we had some people say that their dogs went in for dentals and had pieces of wood wedged up in their teeth. Now, you might not have been able to see those even if you had been looking, because they can be hidden in there, they can be hidden on the inside. But if you look all the way in the back, do you see gum inflammation? Do you see redness? Do you see a discharge around the base of the teeth? It's really important to look. And I was always amazed in practice at how many people had never looked in their animals' mouths. So I would do a physical exam and I'd see these rotting, horrible teeth. And I would lift up the lips and turn the animal toward the owner and say, these are rotten. When was the last time I've never looked in there. Oh my gosh, that's horrible. And what I found is that, for many years we would tell people, your pet needs a dental, your pet needs a dental. But we didn't open the mouth and really get in their face and say, look what's going on in here. And when you do, all of a sudden it's an eye-opener. Then people were all over, wow, that looks terrible, that looks painful, those gums are really red, wow, there's pus coming out, it stinks, wow, I wondered where the smell was coming from, I kept giving them a bath. Look down in the ears. Check the eyes. Is there any redness there? Is there any discharge there? Look in the mouth. Check every inch of your animal. And some of them don't like to let you in their mouth. So whatever it takes to get in there. So if you even can offer them a treat or, freeze a Kong or something with something good in there to get them to be licking, get their attention so that you can get a peek. Even animals that we had muzzles on, I would shift that muzzle around so that I could at least peek open the gums and see what's going on in there. But you really need to be doing a hands-on touch feel. Get a drawing of your dog, mark down, or cat, mark down any lumps that you find, how big they are. You can get a ruler and measure them so that if they're changing, you can go back to that drawing that you have and you can put in there, okay, on this date I found this lump, it's this big. And then make sure that you go back in a month, remeasure it. Oh, that thing changed. Get it looked at. So you're Aussie at MCT, so she's checked daily, and now it's tick season. They're checked a few times a day. Yeah, absolutely. Dog Care 101, we all need a good reminder. Well, dog, cat, whatever. It is true, and it's funny because when Sweta sent me that picture, I thought, nobody routinely looks up under the lips. And I have to say, I've been a little lax in doing that with our guys in the last few weeks. We've been busy with a lot of things. Can I do a video on a whole body exam? I can. I've done it before when we adopted Stewie. So if I can figure out what month that was, I could probably go back and find the video, but we actually did it in my office when I took him in. We did a full physical exam, nose to tail, we did blood work, and we showed the whole thing. But yeah, certainly I can get Hugh to give me a hand. We can pop one of the little guys up on the table. I don't have all my vet equipment, but I can show you what you should at least be doing at home. Yeah, you can also, Heather, that's a good thing, instead of making a drawing, you can take pictures of lumps and bumps, but you still need to mark those pictures so that you know how big they were. And a good groomer does a good inspection. That is very true. A good groomer will, very commonly people would bring their animals in and say, well, the animal was at the groomer and the groomer found this lump, or the groomer found infection in the ear, or the groomer found the abscessing anal gland. So your groomers can be very valuable for that as well. Jane Lister says, yes, I have the Stewie video somewhere. Yeah, it's really important, and you need to, and that's one of the things that's in the new book that we're working on, where it really talks about the physical exam on your animal and holding your veterinarian accountable. The veterinarian who was up the street from us in Pennsville never did physical exams on animals, ever. If they were in for vaccines, the cats weren't even taken out of carriers. He reached in, stabbed them, and that was it. And that's not what you're paying for. You are paying for a full physical exam, nose to tail tip, entire exam, looking at everything, listening to the heart in 4 places, not one, both sides of the chest, listening to the lung fields, palpating the abdomen. You need to hold them accountable for that full physical exam. Now, a good veterinarian with a lot of experience, they might get through that whole exam in 5 minutes while they're talking to you, and you may not even notice what they're doing, which happened to me a lot. I could carry on a conversation and do a complete exam, and then the owner would say, well, you didn't even do the exam. I'm like, I did the entire thing while you were on your phone or doing whatever. So, but you need to make sure that that's what you're getting, the full physical exam. And ask questions. Were his lymph nodes okay? Did any of them feel enlarged to you? How did his heart sound? Any murmurs on either side? if you ask questions like that, leading questions, and they didn't do it, then that will make them go back and have to do that. How did his joints feel? When you flexed and extended his knees and his hocks and his stifles, did they feel okay? You feeling any grinding in there? Do you think he's got any arthritis anywhere? Any tenderness in his spine when you went down his spine? Everything feel okay on the inside? How did his teeth look? The ears look okay? And the ear inspection should be with an otoscope down, not you, the vet, should be otoscope down in the canal, because if you just lift the ear flap, you only see the very tip of what's going on in there. You need to get down in there and look around the corner. But you need, how is a seroma common in spay? It can be. How long before it goes down in size? It should go down in within a week. Now that you don't go into the vet's office, you might not know. Very true. That's why you have to ask those questions. So when they get on the phone, some veterinary offices actually sort of have a cheat sheet that's in their computers or in their records where it lists every one of, lymph nodes, heart, lungs, abdominal, it sort of lists everything, and they have to check normal, abnormal, and then if it's abnormal, they have to write in what it was. That's awesome if you get something like that, because then you know that they looked at all those things. But yeah, it's really hard. So I would say ask leading questions when you get on the phone with them. Ask them, how did his teeth look? Are his ears okay? Any signs of infection down in there? How does lymph nodes feel? Heart sound okay? Just ask those kinds of questions so that you get those answers. Need the vet list of question sheet. All right, that's another download I guess we can do. Yeah, man, you guys are giving me work to do. All right, so let's see. Photo of dog. Document. Lumps. I'm writing. And list of questions about the physical exam to ask vet. Okay, we'll do another download, I guess. Oh, man. Thanks, guys. What to do if your dog doesn't like anyone touching them? Your Shiba's extremely reactive. Yeah, those Shibas, some Shepherds, some Rotties can be really difficult. So if you want a complete physical, get them some sedation. Get something to calm them down. Animals, gabapentin, we've been using a lot, or vet offices have been using a lot for chilling out cats. So it works really well for kitties, not as well for dogs. But, if you have a fractious animal, at some point in their life, they really need a good physical exam. And if that requires a little sedation to get them through it so that it's not so anxiety producing for them and for the people who are working on them, it's really important. How do you know what's going on with your animal if you can't get blood work, if you can't do a full physical exam? So I would be working very hard with that dog to try to get it used to doing those sorts of things. You could, start using CBD or other products to calm the animal, to try to, and just go slow. It's sort of like working with the donkeys right now. Everything has to be slow. One of Jasmine scraped her coronary band right above the hoof on the front the other day, and I saw a little blood. And she's the one that had never been touched. We finally got a halter on, and she takes carrots and lets my mom brush her. But we hadn't touched her feet, and I needed to get near that foot. So it required a lot of finesse, and I held onto her halter and followed her while she was going backwards without applying pressure. I followed her. We went the same speed, and I was able to kind of hold the halter up here and bend down with the other hand and kind of wash the foot with every step that she was taking. And we got it cleaned up enough to know that it was nothing serious. Yesterday, my mom spent a lot of time brushing her and brushing all the way down her legs, all the way down her back. And it's just taking your time with these animals that are nervous, anxious, scared, whatever it is for them, and not using brute force. And so dogs like that, we used to just use brute force, and that's not a good way to do it. Not a good way to do it. It's much better to give them some sort of sedative or relaxation drug, herb, whatever, to make it less stressful for them. Okay, got to get going. Got to get out to the barn and feed. Miss Ella is very close to hee-hawing for me. The hinnies make a really weird grunting noise. Very strange. And Ella is going, not quite a bray. She's working on it. I'm going to get a video of her braying. Can't wait. Feeling round dash now. There you go. Yeah. So, donkeys are coming along. Loving every minute with them. It's interfering with me getting any work done. All right, everybody have a great day.